Friends, diabetes is probably the commonest lifestyle disease in India. In fact, India is already called the diabetes capital of the world. The incidence of diabetes is rising further and fast. This is because rising incidence of childhood obesity, increasingly sedentary lifestyles that Indians are now living with, and of course we are now living longer. Every diabetic has one question: what to eat and what not to eat. And every doctor who treats patients with diabetes gets this question from every diabetic patient. It won't be out of place to discuss here today the do's and don'ts of diabetic diet. I am Dr. Prasad, a consulting physician, and you are watching Let's Talk About Wellness. Let's first see what are the do's that a diabetic person must follow. A diabetic person must indulge in regular physical activity as far as possible early in the morning. This will help him manage the blood glucose levels effectively. Please remember, the mainstay of treatment of diabetes is proper diet and optimum exercise, and drugs act only as adjutant to this regimen. Even throughout the day, ensure that you don't sit on a chair for a very long time at a stretch. Move around. Even while sitting, shake your legs from time to time. This appears funny, but it is very helpful. You must have your pre-workout meal 15 minutes before starting your exercise. This will help you to prevent your blood sugars going low or you developing what is known as hypoglycemia during the workout. This can be a fruit like watermelon or few almonds, dates, white figs, or spoonful of peanut butter. You must also eat your breakfast within 30 to 45 minutes after your workout. All this is presuming you do a proper workout and optimum exercise every day. This will prevent post-workout hypoglycemia and subsequent complications. Eat breakfast which contains a balanced meal as far as possible. So your breakfast must contain protein in form of eggs or meat or dairy products such as cheese, milk, buttermilk or curd. You can derive proteins from sprouts, beans, soya and tofu also, provided you like them. If you are taking insulin, you may have to eat small healthy snacks between breakfast, lunch and dinner to prevent your blood sugars going low. You must ensure adequate water intake throughout the day. This will help digestion, prevent dehydration. It will also help you to maintain electrolyte balance and prevent constipation. If you are taking insulin, measure the dose carefully and take it on time. Before eating main meal, if you eat a boil of cucumbers, beet, lettuce, carrots, green onions or similar salad vegetables, you will realize that your blood sugars do not spike after meals. This will also give you adequate fiber. Fiber not only makes bowel movements easy, it also ensures growth of good bacteria in your intestines. And this has immense impact on control of diabetes and prevention of many lifestyle diseases. It is good practice to eat dinner as early as possible. The idea is to remain active for at least 2 hours after dinner. In this context, Shatabhavali is a very good practice. If you are taking insulin, you must ensure that availability of food is assured before you take dose of insulin, especially when you are traveling. Take insulin only when you are sure that food is available and you will now eat that food. Also carry glucose powders or tablets for use in case of sudden hypoglycemia. You may consume a glass of skim milk without any sugar 30 minutes prior to bedtime. It is better to make a meal timetable and adhere to it strictly. Regularity in meal times will avoid hypoglycemia episodes as well as sudden surges and crashes in blood sugar. Maintain a food diary to keep rough account of calories you consume. You can now use variety of apps on your smartphones for maintaining a food diary. Friends, I think we should stop this video here. In next video, we shall discuss the don'ts of diabetic diet. Thank you very much.